You're tuned into Inside Lowell. Inside Lowell podcast brought to you in part by Washington Savings Bank, serving the greater Lowell community for over 130 years. Make the switch now to Washington Savings Bank.
Wellpoint. Unicare is now Wellpoint. New name, same commitment to Massachusetts. At Wellpoint, your whole health is their whole point.
Boston North Company, offering a wide variety of business solutions to help restaurant and retail clients save money. Boston North. Mahoney Oil Company, providing warmth and protection to families in Greater Lowell and Southern New Hampshire since 1925. That's Mahoney Oil. Francis E. Preventia Insurance. For auto, home, business, and life, trust the agency Greater Lowell has counted on for more than 40 years. Francis E. Preventia Insurance. GoPuff, a grocery store right at your fingertips. Use the code Lowell20 to receive $20 off your first order of $21, plus free delivery. Download the GoPuff app or visit gopuff.com today. And by the Massachusetts Pirates, bringing all the hard-hitting action and excitement of arena football to the Tsongas Center in Lowell. Get your tickets today by visiting masspiratesfootball.com. And now, time for another Inside Lowell podcast. Inside Lowell. If Lowell is your home, this is your place.
Hello again, everyone, and welcome to another Inside Lowell podcast, another Health Minute, sponsored by Wellpoint, which happens to be coming to you from the Wellpoint Studios here in beautiful downtown Lowell. Unicare is now Wellpoint, new name, same commitment to Massachusetts and to its members. At Wellpoint, your whole health is their whole point. And joining us here in the Wellpoint Studios is the medical director at Wellpoint and our guest every month for our Health Minutes, Dr. Carolyn Langer. Good morning, Dr. Langer. How are you?
Good morning, Teddy. Great to be here again.
Yes, great to have you here in June, because June is Men's Health Month. And for the stubborn men out there like yours truly and all the others, why is men's health so important?
You know, it's really important for men to understand that their strength, their vitality, their mental health really start early, and it's important to establish good health habits at a young age. Are
there differences between health issues that afflict men versus women? I know historically we've known about, men more prone to heart disease, high blood pressure, these type of things, et cetera. Is that still the case? And if so, what are some of these issues that men should be more vigilant about?
Yeah, it's important for men to recognize that certain types of conditions like diabetes, heart disease, certain types of cancer, the probability increases as they age. And so it's important for them to get regular preventive screening because many of these conditions are preventable.
It's said that men will do anything they can to avoid asking for directions when they're lost and getting checkups regularly with doctors. How often should we get checkups and when should we start?
So you should start getting checkups in early adulthood, but certainly as you reach middle age, you should be getting annual exams. And it's important to have a regular, close relationship with a primary care provider so that you feel open and can be honest in your discussions.
What are some of the important preventative screenings that we need to be getting?
So there are a number. So some basic things that your primary care provider will want to check are your height and weight, your body mass index or BMI. Depending on your risk for cardiovascular disease, they may want to periodically check your cholesterol levels. In addition to that, there are certain types of screenings. So for example, colorectal cancer screening, it's recommended that men undergo regular colorectal cancer screening between the ages of 45 and 75. For individuals who have a history of being overweight or obese, it's important to also check your blood sugars or your glucose levels, particularly between the ages of roughly 40 to 70. There are a number of other important screenings. So, for example, for individuals who are between the ages of 55 and 69, it's important that you discuss prostate cancer screening with your primary care provider as well.
So the colorectal screening guideline has changed, right? You said 45. It used to be 50.
Yes, it
Right.
has moved down to 45, and depending on family history, your provider may want you to screen more frequently, but the general rule is every 10 years. But again, for people who may have certain risk factors or family history, your provider may request that you screen more frequently.
How important is that family history? Just yesterday, I had to get a new primary care physician, and my first appointment is coming up. And I went up through the online portal, and they asked that, and I kind of half-assed it, pardon the language, but I'm thinking I should go back and try to be a little bit more thorough with it. How important is it? And when they say family history, are they talking parents, siblings? Should I go so far as aunts and uncles, cousins, grandparents? How far or how extended should I get in that family history?
Yeah, so family history really is important because it could place you at increased risk for certain types of conditions. So, for example, prostate cancer, diabetes, heart disease, and certainly you want to share family history for your first degree relatives, like your parents, like your siblings. But it's important to be as thorough as possible and indicate any other close relatives who might have had a history of these types of conditions.
We've talked about mental health in the past and things such as anxiety and depression. Again, men try to avoid even acknowledging those issues, but we really shouldn't ignore them. How can we kind of go about getting help in that regard?
You know, it's really important to recognize the symptoms because work, family life, all these things can really take a toll on your mental health. So it's important for men to, first of all, express how they feel, to seek help when they need it. And there are small things that you can do on a daily basis. So surround yourself by optimistic people, but think about talking to a physician if you are feeling a higher than normal level of stress. They can help you identify various treatment options. Make sure that you're exercising regularly. Try to fit in about 30 minutes of regular exercise a day. Try to eat healthy foods. Try to eat at least 2 cups of fruits and 3 cups of vegetables a day. Avoid processed foods, avoid foods with added sugars. Think about really reaching out to friends and loved ones. Importantly, it's really critical that you set realistic goals for yourself. You know, sometimes many of us set these very lofty or ambitious goals, which only tend to overwhelm us and to discourage us, and that can further add to our stress. But another great way to manage your stress levels is to spend time with friends, spend time volunteering, or spend time doing things that you enjoy, such as exercising.
Yeah, kind of those last two themes that you hit on. Go see a doctor. Don't put it off, as we men are prone to do, but also preventative steps that you take go a long way towards avoiding these issues: lifestyle, exercise, diet, etc. So it's good to see you reinforcing those. Seems like those are important in every component of health that we talk about, right? Whether it's physical or mental.
Yes, and you know, seeking out help, whether it's from your primary care provider or a mental health specialist, is really a sign of strength. It should not be viewed as a sign of weakness.
All right, Dr. Carolyn Langer, as always, thank you for joining us here. June is Men's Health Month, and hopefully folks watching this have learned a little bit more about the importance of men's health from you.
Thank you very much. Really appreciate being here today.
Always good to have you here, and always great to have you joining us here as well for this Health Minute brought to you by Wellpoint. Till next time, stay safe, everybody, and now you're armed with all this knowledge, stay healthy.